The number of coronavirus cases across the Americas continues to rise. Brazil has now reported over 16,000 cases, and its Supreme Court has blocked President Jair Bolsonaro from lifting the quarantine measures applied by some local governments across the country. Cuba has sent its 16th Medical Brigade to combat the coronavirus to Angola, made up of 214 health professionals. Examples of international solidarity abound in the midst of the coronavirus pandemic. China and Russia are working together to build a hospital to treat COVID-19 patients. From the headquarters of Telesur English in Havana, Cuba, this is From the South. I'm Katrina Goss. Brazil's Supreme Court has blocked President Jair Bolsonaro from lifting the quarantine measures applied by some local governments in the country. As the novel coronavirus rapidly spreads across Brazil, activists, artists and civil society organisations are working to provide information to residents of the poorest neighbourhoods on how to protect themselves. While President Bolsonaro has dismissed the virus as a little flu and called for people to get back to work, some regional and state governments have shut down non-essential businesses and banned public events in a bid to contain the epidemic. The country's health minister has warned that the public health system is headed for collapse. Brazil has now reported over 16,000 COVID-19 cases and more than 800 deaths. And our correspondent in Brazil, Brian Mayer, brings us more details on the situation there.
Last night, the government announced that 133 people had died in the previous 24 hours due to the coronavirus. This is the highest death count to date in Brazil. Now, a lot of journalists and public health specialists have been saying all along that the official numbers are much lower than the actual infection rate because of lack of testing. In fact, Health Minister Luis Mandetta has admitted this. So as they're ordering more and more tests from China, as they're beginning to roll out more and more tests, journalists and health authorities are coming up with different ways to estimate the real number of infections. And one of the ways of doing that is by comparing hospitalizations for pneumonia during the month of March with those of March 2019. And the results of this show that those hospitalizations were 4.5 times higher last month than normal. Last night, President Jair Bolsonaro gave another speech extolling the virtues of chloroquine, which has not been properly tested in Brazil yet. And he announced that it's rolling out into the health system. They're producing massive amounts. They're purchasing it from abroad. And that people should go back to work, and if they get sick, they've got this medicine that can just cure it, he says. Luckily, the state governors are still just ignoring him when he says these kind of things.
Peruvian President Martin Vizcarra announced on Wednesday that the state of emergency will be extended until April 26, having analysed various reports submitted by the Ministry of Health and his professional team of advisors. Peru has reported 4,342 cases and 121 fatalities.
Becomes imperative to extend the state of emergency for 2 more weeks. The state of emergency that culminated on Sunday, April 12, extends until Sunday, April 26.
The Public Prosecutor's Office of Ecuador has opened an investigation into allegations that personnel at hospital morgues are demanding payment from relatives in exchange for the bodies of those killed by COVID-19 in the city of Guayaquil. The city is the epicenter of the coronavirus outbreak in Ecuador and has seen dramatic scenes as residents are faced with a lack of both morgue space and funeral services to bury or cremate their loved ones. Ecuador has officially reported over 4,400 confirmed coronavirus cases and 242 deaths, but the real figures are thought to be much larger. Medical professionals are exposed to risks due to a lack of adequate protection. According to the most recent report by the Guayas College of Nurses, 7 nurses have been killed by the COVID-19 disease, while almost 150 others have tested positive. And Chile is the second worst affected country in the Latin American region by the novel coronavirus pandemic. Chile has reported over 5,500 confirmed cases and over 50 deaths so far. Meanwhile, Cuban authorities provided an update on COVID-19 figures this Thursday. The island nation now has a total of 515 confirmed coronavirus cases, while the death toll has risen to 15. A Cuban medical brigade set off for Angola on Thursday to support the fight against the novel coronavirus. The brigade is made up of 214 Cuban health workers and joins the previous 15 Cuban medical brigades that have travelled to different parts of the world, including Andorra, Barbados and Italy, to combat the COVID-19 virus. So far, Angola has reported 19 confirmed cases and 2 fatalities. In the midst of the COVID-19 epidemic in Cuba, the examples of solidarity are multiplying both inside and outside the country. Our correspondent in Havana, Fabiola Lopez, offers us a glimpse into one such initiative in the capital, Havana.
In the midst of the pandemic, a humanitarian gesture was publicized on Facebook through this letter from a beneficiary. 2 Italian owners of a Havana restaurant are providing lunches for the elderly in one of the most affected municipalities of the capital. Telesur decided to investigate the story and headed to the Bella Ciao restaurant in the municipality of Playa. This is what we found.
Telesur? As soon as I get up in the morning, I switch on Telesur and watch it all day.
Are you following the coronavirus situations on Telesur?
I always watch Telesur. Comrade Chavez. I gave her a uniform in honor of Chavez.
Why? Are you an admirer of the Bolivarian Revolution?
Always. I'm a pathetic communist.
For how long have you lived in Cuba?
For 20 years.
Currently, Bella Ciao is empty. However, it continues to offer its services with just 5 workers. Now they only prepare takeaways and lunch for 29 older people in the local neighborhood.
The Cuban initiative to send Cuban doctors to help Italians in Lombardy made me think that if these people are going to help Italians, why am I, here in Cuba, doing nothing? In my little world, I made this effort, which is an effort to feed 29 people, all older persons. That was the initial motivation.
Saverio and Aldo participated in the first Cuban-Italian gastronomy joint venture back in 1999. Since then, they've fallen in love with this island and established themselves here. 7 years ago, they decided to start this business together, which they opened on a special day for them, May Day. Today, the letter of gratitude from their neighbors published on social media has surprised them.
It was not done for the publicity. It was done due to several things. One is our human conscience, also solidarity. That was the incentive for other restaurants in order to neighborhoods to join us. If we raise awareness and everyone does the same thing, and we are 100, we can solve a bigger problem.
Ines, this neighbor of Bella Ciao, wants to make her gratitude public.
We do not have to go out for lunch, which is very important to me, and all my friends are very grateful for the gesture of this gentleman.
Saverio insists on explaining why the waitresses at his restaurant wear a red beret.
Apart from being a follower of Fidel, and I am not ashamed to say it, it's not propaganda, it's not convenience, nothing like that. In honor of Chavez, who so unfortunately died, he was always wearing this red cap with the star, so I decided to make the uniform red, with the writing of Bella Ciao in black or white, and with the beret of Chavez.
The farewell could not be otherwise, listening to Bella Ciao in several languages. Aldo is moved. He explains that it is a song of humanity, of a struggle, without doubt, an appropriate melody for grateful Italians who themselves are offered gratitude. Fabiola Lopez, Telesur, Havana.
More stories coming up after this very short break, so don't go away. Welcome back to From the South. New York State, the epicenter of the coronavirus outbreak in the United States, saw another record number of COVID-19 deaths in a single day on Wednesday. Veteran doctors and nurses have voiced astonishment at the rate at which patients are deteriorating and dying. The novel coronavirus has officially reached more than 2/3 of the nation's rural counties, with 1 in 10 reporting at least 1 death. Nationwide, there are over 454,000 confirmed cases of COVID-19 in the United States, while over 16,000 people have died. For the second day straight, the virus killed at least 1,900 people in a 24-hour period. More than 6.6 million people lost their jobs last week in the United States as the coronavirus pandemic brought the economy to a standstill. According to the US Labor Department, 16 million jobs have disappeared in the last 3 weeks. In Florida, hundreds of unemployed people wait in line, hoping to fill out unemployment assistance forms after the website to complete the process online crashed due to the huge increase in new applications. The unemployed expressed despair in the midst of the lockdown and social distancing measures. The US Federal Reserve warned of an increase in the unemployment rate of up to 30% in the worst-case scenario. US economic activity is predominantly driven by debt-driven consumerism, which has been heavily impacted by the outbreak. Spanish Prime Minister Pedro Sanchez defended his decision to extend the country's state of emergency on Thursday, stressing that the current lockdown was proving effective. Over 15,000 people have been killed by COVID-19 in Spain.
After these weeks, when the battle has been agonizing, we are seeing that the fire that started the pandemic is starting to stay under control. The data we prudently use are positive. We have reached and gone past the peak of contagion from COVID-19. We find ourselves near the beginning of the downward slope, what is called the de-escalated.
Nearly a month after a nationwide lockdown was implemented in Italy, debates are ongoing on whether to lift the measures. As the country with the biggest COVID-19 death toll in the world, at over 17,000, Italy's next moves will be closely watched. The authorities have been reviewing the lockdown measures every 2 weeks. In the meantime, a hospital in the northern Lombardy region has introduced robots to help nurses caring for coronavirus patients. Nurses wheel them to the patient's room, and once near the bed, doctors can use them to remotely monitor their condition, while patients can use the robot's touchscreen to directly communicate with their carers. The United Kingdom is entering what scientists say is the deadliest phase of the outbreak, with deaths expected to continue to rise over the Easter weekend. The latest figures show that the total number of COVID-19 deaths in hospitals has reached over 7,000, while the number of infections tops 60,000. Meanwhile, the Home Office announced the introduction of a new process to speed up incoming shipments of medical supplies. Prime Minister Boris Johnson has been moved out of intensive care and back to a general ward at St Thomas's Hospital in London. The UK government response to the pandemic has been heavily criticised, and frontline workers continue to be exposed to risk due to a lack of personal protective equipment. Russia reported a record single-day increase in novel coronavirus cases on Thursday. Almost 1,500 new cases were confirmed, taking the total to over 10,000. According to the Coronavirus Crisis Response Centre, the number of COVID-19 deaths rose to 76, while 1 million tests have been conducted so far. In a televised address, President Vladimir Putin announced that he was ordering an extension of the nationwide paid holiday, a measure designed to increase social isolation until the end of the month. In the Russian capital, Moscow, residents are only allowed to go out to buy food or medicine at a nearby store, or seek urgent medical help, walk their dogs, or take out the trash. Japan reached 5,000 coronavirus cases on Thursday, with the rate showing no signs of slowing, despite a state of emergency imposed this week in Tokyo and 6 other areas. According to health authorities, the total number of cases does not include a further 715 on board a cruise ship that docked in early February in the port of Yokohama. The state of emergency gives local governors stronger legal authority to urge people to stay home and businesses to close. In contrast to stringent lockdowns in other countries, with fines and arrests for non-compliance, enforcement in Japan will rely on respect for authority and social discipline. China has reported 0 local coronavirus infections in the past 24 hours, for the first time since the epidemic began. The news represents a milestone in China's costly battle against the virus. While the number of new cases has steadily declined since China imposed strict travel restrictions, authorities have called for continued vigilance amid fears of a resurgence of infections as the economy comes back to life and more people begin to move around. China took new measures on Wednesday to try to prevent asymptomatic silent carriers of the new coronavirus from causing a second wave of infections. The Beijing government announced on Thursday new guidance for bars in the capital, ordering that tables be set at least 1 meter apart and vigorous disinfection efforts. A temporary hospital is being set up in an office building in the northeastern Chinese city of Sufane, located along the border with Russia. The decision came amid mounting pressure due to coronavirus cases imported from across the border. The health facility will provide more than 600 beds with around 400 medical staff. According to Chinese health authorities, 40 cases of people returning from Russia were confirmed on Wednesday. And we're taking one last break now, but stay with us for more. Welcome back to From the South. Indonesia reported its biggest daily rise in coronavirus deaths on Thursday and now has the highest death toll in Asia after China. The Indonesian Health Ministry confirmed 280 fatalities in the last 24 hours, as well as 337 new cases, also a new daily high. The country has now reported a total of 3,293 cases. Large-scale social restrictions have been imposed, but President Joko Widodo has refused to impose a total nationwide lockdown. Researchers at the University of Indonesia have predicted there could be 140,000 deaths and 1.5 million cases by May unless tougher curbs on movement and gatherings are imposed. Iran's Supreme Leader Ayatollah Ali Khamenei suggested that mass gatherings may be barred through the holy month of Ramadan amid the coronavirus epidemic. Iran has reported over 64,500 confirmed cases and over 4,000 deaths.
Logically, we are going to be deprived of public gatherings for the months of Ramadan. Those gatherings are meetings for praying to God or listening to speeches which are rarely valuable. In the absence of these meetings, remember to heed your prayers and devotions in your solitude.
The number of coronavirus cases continues to rise in South Africa, the worst-hit nation on the continent. 5 more people have succumbed to COVID-19, bringing the death toll to 18. Meanwhile, the total number of cases is 1,845. South Africa is currently in its second week of a 21-day nationwide lockdown, in which non-essential workers are required to stay home to curb the spread of the virus. According to the Health Ministry, the country has tested 63,776 people in the past 2 weeks. Kenya's courts have been closed for nearly a month due to the coronavirus outbreak. The country has imposed restrictions on movement and a curfew. With most courtrooms empty, judges and lawyers are self-isolating and only hearing urgent cases online. Some lawyers are calling this a dereliction of justice, while human rights activists are concerned that rights and the rule of law have been suspended in the midst of COVID-19.
It is often said that justice delayed is justice denied. The human rights and justice will not wait for the pandemic to come to an end, nor will the women who are raped and abused over this period, nor will the people who are in mandatory quarantine be able to wait. And lastly, those who have faced police brutality will not be able to wait for the pandemic to run its course. It could take 4 months for this to happen. So the judiciary has to find ways of ensuring that justice can continue to be dispensed over this period.
World-famous Cuban ballet dancer Carlos Acosta, now heading the Birmingham Royal Ballet, has directed a unique solo performance of The Swan as a gift to all during this coronavirus pandemic.
Welcome everybody in this moment of stillness. We are going to try today a sort of experiment. I frankly don't know how it's going to turn out. But we're going to perform for you live one of my favorite pieces. They will be performing The Dying Swan, but I purposely changed the end. So this is a dance about life, about hope. absolutely beautiful. Do you like it? I hope so. And that is why art is so special. That is exactly why we exist. To bring you a moment like this, something beautiful, sublime, meaningful. And this is a gift from the Birmingham Royal Ballet to you. Bye.
And with this beautiful piece of dance and music, we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And join us on social media, Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss, and thank you for watching.